Hello and a very warm welcome to the programme from me, David Foster. You know, coping with a global pandemic was always going to be tough, but what this appears to have shown is that health systems right the way around the world are fragmented, underfunded, and have in most cases underperformed. This is Roundtable. You know, we've been wondering whether there's a single country hit by coronavirus that can say its health system has done exceptionally well. What has this crisis then shown us about a coordinated global health response? Perhaps that there hasn't been one. Is it time for a new approach?
The coronavirus outbreak is overwhelming health systems across the globe. Governments have asked their citizens to stay home in a bid to save lives and protect health services from being overstretched. In the UK, the phrase "protect the National Health Service" is a core part of the coronavirus public information campaign. However, health services in the UK and other rich nations like the US, Spain, France and Italy have been pushed to breaking point by the coronavirus pandemic. There's been a shortage of frontline healthcare staff, of personal protective equipment for workers and coronavirus testing kits. And the death toll continues to rise in these nations, with the US reporting around 80,000 deaths, the highest in the world. Some nations' health systems are doing better in containing the disease. After South Korea's first coronavirus case appeared in January, the government quickly tested millions of residents for the disease. New Zealand has reported its daily new cases are almost zero, after adopting a strategy of extensive testing and strict border controls. So why are some health systems responding better to the coronavirus crisis than others?
Okay, time to get talking on the programme. Later on, we'll be hearing from Barbara Prainsack, political scientist with expertise in the medical sector, and Rosa Castro, senior policy officer at the Federation of European Academies of Medicine. But first, very pleased to say we're joined both in London by Robert Yates, Executive Director at the Centre for Universal Health at the think tank Chatham House, and Rifat Atun, Professor of Global Healthcare Systems, Harvard University. Great to have you both on the programme. Rifat, let me start with you first of all. I posed the question in the introduction, is there any country that healthcare system there could be held up as a global gold standard? Is there one?
Well, I think there are more than one. I think there are a number of countries that were able to act early and have been able to limit the number of cases as well as number of deaths. We could include, for example, Austria, Australia, New Zealand, Taiwan in this group. Then there is a second group that were able to use technology to identify individuals infected, isolate them, quarantine, and use contact tracing to really contain the epidemic. And South Korea, I think, has been outstandingly successful. And Singapore in the first part was successful, but the number of cases are rising.
I suppose what I'm wondering is whether that's down to organisation or to the health system itself. Should we look at the health system and say, look, this is something we should all emulate, or is it particular to this crisis?
I think it's a combination of factors. First of all, decisive leadership is critically important. In the case of the first group of countries I mentioned, such as Austria, Australia, New Zealand, the countries did take a decision to move forward, but they also have good health systems, so they were able to cope with the number of cases. In this case of South Korea, we see a very interesting approach where the leadership focused on bringing together both the public and private sector to use the available technologies, develop their own capabilities for testing, and then use these technologies to contact trace and contain the epidemic. Then we see a number of countries that have been able to use their capacity, such as Germany and Turkey. In spite of the rising cases, they've been able to keep the death rates down. In Turkey, death rates are about 2.5%. In Germany, 4%. Then we see other countries such as Italy, Spain, where death rates have exceeded 10%.
Okay,
in the UK,
Robert,
of
let me come
course.
to you because I know you're somebody who would like to see and believes that this will encourage much more universal health coverage. Um, I know there'll be a desire from the public for that to be the case, but what is going to be the reason other than altruism from a government's point of view? It's going to cost a lot of money if they have to pump billions and billions into their own health services.
Sure. Well, I think the motivation is as much political survival, because I think across the world, populations are demanding this. I mean, this has been a tremendous crisis that's had two major impacts, obviously on people's health, and so people have been dying. People are very fearful that they're going to catch the virus, but also the financial impact, that it has shut down economies, and people are really fearful about their economic well-being. And so one needs responses that react very quickly to this, to protect health and protect livelihoods. And in many respects, universal health reforms do both those two things at the same time. So I think smart politicians will be realizing that this is a very sensible thing to do, and it's a very good way to restart your economy.
Yeah, because one of the things you said, and I'll quote it here, we'll see it on the screen in a second, this would cost around 1 to 2% of GDP, gross domestic product, in the short term, but perfectly affordable in the current economic climate to truly improve health security for people across the world. Becoming ultimate healthcare heroes could be the best strategic decision political leaders ever made. Yeah, I do get that in the long term, it might ensure their political survival, but an awful lot of politics is about surviving right now in the political sense, that is, and there's not going to be as much money around as there was before.
Oh, definitely, and this is where it's tough decisions, but governments are borrowing unbelievable amounts at the moment, and the suggestion is that you spend a good proportion of that sorting out your health system to provide universal coverage, that everyone gets a full range of health services. And the history books show that even at times of great crises, that governments have done this. If you look at the UK, France, Japan coming out of the Second World War, their countries were ruined because of the war. Their economies were extremely weak, and yet they built tremendous health systems very quickly. And this is the point. These are political quick wins, that you can do this quickly. Thailand did the same thing coming out of the Asian financial crisis in 2001. Initially, the World Bank said that Prime Minister Thaksin couldn't afford to do this, but he did. He found roughly 1% of GDP in a year or so. And Thailand is weathering this pandemic particularly well and has a very good universal health system. So even though it might appear counterintuitive, now is the time to do this, I would say.
Okay, Rifat, let me ask you. Obviously, you're both fans of health coverage, universal health coverage to some extent, Robert, absolutely. But Rifat, you've argued that there are some countries which don't have universal health coverage, where private insurance deals are the norm, that have done pretty well in this situation.
Well, countries such as the Netherlands and Switzerland have predominantly privately insured systems, but they also have very good provider systems. So they've been able to cope. Although system is financed predominantly from private sources, there's still individuals are covered. So there's still, one can achieve universal health coverage either through government financing, through social insurance, health insurance, or through some form of private insurance. So what's important is that individuals are not left behind. So we have the population covered. Now, whether the private sector or the public sector plays that role is open for discussion, and it's a very healthy debate among academics.
This is for both of you, but Rifat, we'll stay with you first of all. Is there any prospect of some kind of international treaty when it comes to health that isn't just part of a declaration saying we'd all love it, something that brings countries together to have certain base standards?
Well, there's only been one treaty for health, and that is the Framework Convention for Tobacco Control, which many countries have accepted and have ratified in their parliaments to stop tobacco use, and that has been quite successful. There is no other binding treaty as such. What comes closest to that is the international health regulations, again, which many countries have followed, but there are no treaty obligations to follow these.
So Robert, no international treaty other than the tobacco one at the moment. Is there ever likely to be one that brings all these separate health elements together?
I think potentially, and this is a time that you really do hope that humanity, learns and does cooperate more. As Rifat said, you have the international health regulations, which is a very good start, particularly around infectious disease control. But you do have things like the Sustainable Development Goals that every single country in the world has signed up to, which includes a specific target on universal health coverage. And this has been agreed at the United Nations 4 times in the last decade. And in fact, last September, all the world's leaders said that they were going to achieve universal health coverage. And I'm a strong believer that we are moving in that direction. You're already seeing some countries coming out of this pandemic initiating UHC reforms. And I think it's even going to happen in the United States, perhaps later this year.
I'm just wondering, and I don't want to point the finger of blame particularly at this point, because we just don't really know how it's all going to end up. But are there any particular examples, you first, Robert, and then Rifat, because we're coming towards the end of this segment, where things have gone so obviously badly wrong in terms of the healthcare systems?
Yes, I think that sort of look. You just got to look at the numbers. Numbers of cases and the death rates. Per head of population, and I think it's sadly the case that in Europe, the UK hasn't been performing well, and we were slow to lock down. We were slow to get testing off the ground, and also PPE. And I think the United States as well. I think the highly fragmented US health system is really struggling. And as people are losing their jobs, they're losing their health insurance and are less likely to come forward to get tested. So I would say, sadly, the 2 countries that are performing the worst, in that respect, are the US and the UK at the moment.
Okay, so Rifat, the UK has a national health service. It has universal health care, and yet that hasn't worked here, according to Robert and to other people too. So it's not the answer.
Well, it's an important part of the jigsaw puzzle, but it's not enough to mount a decisive response and to demonstrate resilience to such shocks. What has not worked for many countries, including for the UK, is that the coordination was not consistent. Many countries were very slow to react. In European countries, they wasted 2 months. We knew this pandemic was happening, but many countries waited. Secondly, the capacity in the systems were not augmented to reach surge capacities. We're not able to expand this capacity. Some countries did find capacity, such as South Korea and Germany, but Italy, Spain, UK have struggled in the early stages. Third, supply chain systems broke down. This is unacceptable in the 21st century, that we're not able to get basic testing kit and personal protective equipment. And finally, where countries have failed is that we've not been able to use technology enough. The interventions we've been using go back to medieval times, to the 14th century. Isolation, quarantining, contact tracing. These are not new interventions, but we have struggled with the evidence.
I'm sorry to have to jump in, but we are running out of time in this segment. The lesson seems to be that if the foundations are there, then it'll work. But if the bureaucracy doesn't allow those good principles to act, then not even the best health system in the world
would be able to shape as well. I think that's a very big factor. Political leadership.
Robert, I have to stop you, but we heard you. Thank you very much indeed. Robert Yates, Rifat Atun, great to have you on the programme.
Thank you.
Okay, as we continue this roundtable, we welcome Barbara Prainsack, Professor of Comparative Policy Analysis at the University of Vienna, and we say hello to Rosa Castro, Senior Policy Officer at the Federation of European Academies of Medicine. To you, first of all, Barbara, if I may, how loud do you think the international clamour will be for health change after this, or will it be barely a whisper?
I think it will be very loud and clear. And I think we haven't seen the beginning of it. At the moment, we see that lots of people, because of the focus on COVID, have not accessed healthcare services for preventive things, for diagnosis of problems that, as we learn from our interviewees in our studies, people feel they shouldn't be burdening the healthcare system with problems like that in a time of a pandemic. So many of those people will have issues that have increased, health issues that have increased. And I think we are going to see the need for well-funded and well-staffed healthcare systems that give access for all in the next weeks, months, and years to come.
But however loud they shout, the international community, will their voices be heard? Anybody going to listen?
Well, in this case, the need for healthcare is something that it will affect every family. Maybe not every person, but it will affect every family. And I think everyone, either directly or indirectly, has now seen how important it is to have a healthcare system that is strong and that is resilient. So I think the importance of healthcare in a society has really been emphasized during the pandemic, whether or not people were affected directly by COVID or not.
Rosa, you wrote for the Cambridge University Press not so very long ago, pandemics were predictable, yet the level of preparedness shown by countries worldwide, including most advanced economies, was wildly insufficient. Was that because the health systems were badly designed, or the political will and therefore the financial input just wasn't there?
I think I will put first the political will, because it definitely takes a lot of this to make the investments that you need to have strong systems, which is basically what you need for pandemic, or at least is the first prerequisite that you need. And this is something that all the people in the community of global health or in the public health communities it's very acceptable. Everyone agrees that we need to have strong systems at national level, and everyone seemed to agree in this community that there was a big need for preparing to a pandemic. A lot of scientists were warning about this, a lot of experts, journalists, even Bill Gates had a very famous TED talk just a few months ago, warning the world about this possibility. And so there was a very interesting question, but difficult for policymakers, because you need to think about health systems about in terms of a long-term investment.
In that paper, one of the other things you mentioned is that even though there's something called the European Centre for Disease Prevention and Control, the lack of coordination between various bodies is so damaging and so dangerous that it's not just medical crises they need to worry about. It's hybrid warfare, it's cyber attacks, etc., etc. There needs to be a fundamental shake-up of medical side of things and just the way these government bodies talk to one another, in Europe in particular.
Definitely right. So, and this is something that everyone praises, which is collaboration between different sectors is really needed. But if you go into the practice, this is a very big gap. So, for instance, if you ask the people working in public health, what is one of the top concepts there is One Health. Is thinking about health in a broad context. So putting together the health of humans, the health of animals, and our environment. This is a very old concept that people have been talking about in the global health area, but also at national levels. But if you look at the practice, including the ECDC, what they do, well, they do very good things, but they have a limited budget, and in practice, there's a lot of gaps, things that we should be doing better. One example, sharing the data, for instance.
Yeah, and financially around the world. Let's take a look at these figures. I've got them in front of me. They'll come up on the screen in a second. Globally, $7.3 trillion is spent on health every year. This is from the World Health Organization, approximately 10% of global GDP. Now, my maths makes that more than $1,000 per person in the world. And yet almost 50 countries with a total population of 2.7 billion, roughly half the world's population, have spent on them less than $100. And $62 the average per capita expenditure to reach the Millennium Development Goals in the poorest countries. So you've got this massive disparity, $1,000 on average, $62 to take them up to Millennium Development Goal targets, and yet 50 countries spend less than $100. How do you make the system fairer, more balanced globally? But Barbara, you first.
There's clearly a need to think about equity, not only in access to healthcare, but also quality of healthcare in global terms. But I think it's also important to think of inequities within our own societies. And an important thing to mention here is that more money spent per capita does not necessarily translate into better healthcare. So we see countries in the world like the US, where a lot of that money that you just mentioned actually goes into administration and bureaucracy, whereas in other countries with healthcare that is free at the point of use, you have a lot of savings just from the fact that you don't have to spend all this time and money and resources and billing and on administration. So I think there are, first of all, opportunities to save where the money does not disadvantage patients. So the money still goes to patients, still improves their healthcare, yet it translates into net savings. On the other hand, there are lots and lots of measures that can improve the health and well-being of populations that don't cost so much money, both in the rich and in the poor world.
And Rosa, I know you do an awful lot of work in developing countries, Venezuela being one of the countries that you are very well versed in the affairs there. And a major concern is if and when there is a vaccine, sorry, let's just say when there is a vaccine, how does it get to the right people in the poorer countries who because of the lack of health systems they may have, could be much more affected than people in developed countries?
Exactly, and that's a very important question. Now, the global community, scientists all over the world have mobilized to accelerate the development of a vaccine, which will take us hopefully out of where we are right now. But what happens when we have the vaccine? And the good side is that a lot of people is already asking that question. So this question of the affordability of who will be able to pay for that vaccine is being discussed at the WHO, and it's been discussed, in a wide community. However, this problem is very complex because here you have, on the one hand, you have intellectual property rights that are protected by international agreements, and this for a long time has been a very complex question discussed. In the international area, you have to take into account at least the WHO, but also the trade rules. So what the World Trade Organization does to protect this intellectual property. You do want the pharmaceutical companies to have incentives to develop new vaccines and new technologies, but you do have to ask the question of who will be ultimately benefiting from them.
See, this is rather depressing in its own way. We know how many years it took to get cheaper generic drugs to the people that most needed them in the poorer countries, because drugs companies were taking a vast slice of the profits and selling their own versions of this. We've heard criticism of the World Health Organization because it is unable to enforce any of its recommendations. It's a pretty toothless body. So, Barbara, if there's no means to force drugs companies to do this, what kind of process is going to have to be gone through to get these vaccines to the poorest people in the world?
There needs to be a lot of political pressure, and I think there needs to be a lot of pressure from citizens, from people, and this needs to go far beyond what we see now with COVID. But I do believe that some of the issues that we see now with COVID highlights some of the larger structural issues of how the political economy of health and also of drug development and vaccine development works. And hopefully there will be some lasting changes.
I will come back to Rosa on this one. It's rather depressing, isn't it? Because there's no means to enforce any of this pressure, and it could cost an awful lot of money to get these drugs to the people that need them in the poorest countries.
Yes, but I think Barbara has a very important point, and it has worked in the past, fortunately. So with HIV, of course, it was a very long battle and a very dramatic one. But in the end, the action by citizens and the political will to act was very crucial to have these generics antiretrovirals getting into poor countries, into the people that needed them. I think that apart from those, we have learned a lot during the past decades. So there's a lot of very innovative ideas. For instance, patent pools have been proposed and are being discussed right now. So pooling together all these intellectual property rights and making sure that this arrives to the people that need them, to the countries that need them. These are one idea. Also, prices designed specifically to get the medicines that we need. All of these, I think, should give us a very important lesson, and we should take it not only for COVID-19, but for the world that we want after COVID-19.
Yeah, a lesson, and some hope, perhaps. Listen, thank you both very, very much indeed for being on the program, and thank you very much for watching this special edition of Roundtable, once again on the ripple effects of the coronavirus. We thank you for watching. We hope you stay safe, and we hope you stay with us here on TRT World. Goodbye for now.